Hi, welcome to Case of the Day. And this is today's case. We scanned this patient yesterday and then I read it today. And the title is What Does Multidrug Resistant Tuberculosis Look Like on CT Scans? So, this 32-year-old was diagnosed to have sputum positive, drug sensitive TB in June 24. There's no prior imaging, but the patient hasn't improved clinically, is losing weight, has fever, and a recent radiograph shows extensive disease. On the axial images, we have cavities in at least three lobes here, consolidation, bronchiectasis, tree and bud, extensive disease. And the coronal images show that really well. And again, cavities in at least three lobes, consolidation, air bronchograms, tree and bud, all of that. So it is likely. So these are findings that typically suggest that a patient has drug resistant TB. So, what are the CT scan manifestations of DR-TB? There is surprisingly not a lot of literature on CT scan. So, there is some stuff from 2009 and 10. Then there is this paper from China in 2017 in PLOS, which just basically said extensive cavities and bronchiectasis is what you get in MDR-TB. And then in 2023, this paper was published, which is an expert consensus on imaging diagnosis of drug-resistant TB, and they've got multiple modalities in that. And I would just wonder that why can't we come out with these papers? But anyway, this is what it is. So I took the paper and then asked ChatGPT to tabulate the findings. And if you're looking at MDR or polydrug resistant or XDR TB, basically if you have cavities larger than 3 centimeters in greater than 3 lobes bilateral, consolidation with the cavities, tree and bud obviously you would get, and then nodules, etc., then these are all findings that would suggest MDR-TB. And if you see our patient, the findings fit in perfectly, right? Large cavities, consolidation, bronchiectasis in more than, in 3 lobes, and all of those findings that I just mentioned in the table. So the question, of course, which is a clinical question, is was it MDR to begin with, or did things change in the interim in the last 11 months? Those things, I guess, the referring doctor will have to sort out and figure out. But for us, MDR-TB can be thought of when there are large cavities in more than 3 lobes with consolidation, bronchiectasis, and other typical findings. How would you read it then? I would say, and I didn't say this though, but I would say that multiple cavities are seen with consolidation, bronchiectasis, and extensive infectious bronchiolitis, findings that are consistent with a diagnosis of tuberculosis. These features are linked with the possibility of multidrug resistant TB. Remember, in the end, MDR-TB is a microbiological diagnosis, but we could mention that these are supportive findings in the report and then leave it at that. And I should have done that. But then I hadn't gone through these papers at that time, and now I'm a little wiser. So these cases of the day are helping me become a shade wiser as well. That's the WhatsApp channel, and thank you so much for viewing this.